Caregiving for a loved one, it's not just a good deed, it's a public health issue. I'm Lee Zurich.
And I'm Tisha Powell. New research reveals 1 in 4 U.S. adults currently serve as caregiver for a relative with complex medical needs, and most family caregivers are unpaid. But advocates say this invisible workforce in healthcare is desperate for help.
Reporter Heather Graff shows you the search for solutions at the state and federal levels, plus one woman's daily reality amid concerns that a caregiving crisis isn't looming. It's already here.
It's just past 6 a.m. on a rainy morning in Maryland.
The day is the 13th.
And Pamela Talley has been awake for hours.
Cold coffee, it still works.
Cooking, cleaning, prepping, packing, and generally going nonstop.
Good morning.
Because once her son is awake, he's the priority. Xander is autistic and has minimal language skills.
Ready?
His daily routine, largely reliant on his mom.
Can you eat a couple more spoonfuls first? Cat.
Yet even after Xander boards the school bus,
Have a good day.
for Pamela, there is no time to waste.
One down.
A caregiver not just for her child, but her husband as well.
It's having to be everything to everyone.
You see, Kenneth Talley has Alzheimer's disease.
This is his memory patch.
And by 8:30 a.m., Pamela's focus has shifted to her spouse's medication management, blood pressure monitoring, upcoming doctor's appointments, and personal grooming, like shaving Kenneth's face. All of it now falls on Pamela.
So you got a lot on your plate.
I have a lot on my plate. I do.
The family photos that are ever present in this house,
This is a picture of my husband and I on our wedding day.
a reminder of what was before they got Kenneth's diagnosis 2 years ago.
It took my breath away, honestly. He was my co-pilot, we co-piloted this life together. And I thought, how many more memories are we gonna have? How am I gonna support the whole family through this? And there was just so much to get done.
Such is the demanding life of a family caregiver. And as of 2025, the National Alliance for Caregiving says 63 million Americans are doing just that. This new report warns of a dramatic increase in the number of caregivers nationwide, up by 20 million since 2015, as people are living longer and the U.S. population is aging.
Is there a caregiving crisis in this country?
Absolutely. There's an urgent crisis in this country.
Jason Resendez is the NAC president and says the organization's research also revealed family caregivers are stretched thin. Despite having virtually no medical training, they spend on average 27 hours a week caring for loved ones with chronic health conditions, allowing them to age at home and avoid costly long-term care facilities. Meanwhile, emotional and economic strain are widespread among the caregivers themselves.
Going into debt or reducing savings or even leaving the workforce due to caregiving.
If the faucet just stays on, it's just gonna run out.
Pamela knows that struggle because she stopped working years ago when it became clear her son needed more support, and her husband is now retired.
Caregiving is very expensive.
In fact, when we shared with her this AARP study that found family caregivers spend an average of $7,242 annually on out-of-pocket costs related to caregiving, Pamela said this.
When we think about safety equipment, adaptations, bringing in help, the cost can be a lot higher than that.
One of the key challenges that family caregivers face is a lack of supportive infrastructure. From a healthcare perspective, from an economic perspective, from a mental health perspective, we need a regime of policies.
One policy the NAC supports is what's known as the Credit for Caring Act that's been repeatedly introduced on Capitol Hill. It would provide a non-refundable federal tax credit up to $5,000 for eligible family caregivers. Democratic Representative Linda Sanchez and Republican Senator Shelley Moore Capito are among the bill's bipartisan co-sponsors and say it's personal in part because both lawmakers helped care for their own elderly parents with Alzheimer's.
I know from my own personal struggle, wanting to do it the right way, it became incumbent upon me and my brother and my sister to care for them.
Both my mother and my father lived with Alzheimer's for many years, and it was always their wish to stay at home as long as possible.
In advocating for that legislation, nonprofits like the Alzheimer's Association acknowledge they also have ongoing concerns about cuts to Medicaid and caution the caregiver tax credit on its own is not nearly enough.
We do see it as a critical step forward. Of course, more has to be done.
How would you respond to that concern?
I think the expectations that you're going to do everything the first time in its entirety are going down the wrong path.
Yeah, I mean, it isn't meant to be a silver bullet, and if it doesn't happen this term, there's always next term.
The federal proposal so far has not advanced, but Oklahoma in 2023 became the first state to adopt a comprehensive caregiver tax credit up to $3,000, and Nebraska passed similar legislation in 2024.
The state work is critical, but ideally we would have both.
ID, insurance cards, medications.
For Pamela, it's still a constant juggle between her husband and son. But since Kenneth is a veteran, they eventually secured some in-home assistance through the VA.
Companion care coming today at 10 o'clock.
A stopgap for this family, but not a solution.
It's been a pretty tough road.
And on behalf of all caregivers, she says it's past time for this country to act.
We're all going to be touched by the caregiving experience, one way or another. They deserve our support. They need our support.
The Center for Retirement Research at Boston College has actually studied potential support policies for family caregivers, things like tax credits, paid family leave, paid respite care, reimbursement for out-of-pocket costs, or direct payments from the government. The center recently surveyed caregivers about what type of support would help the most and found 44% would prefer assistance in the form of direct payments. But the bottom line, according to the national advocacy group Justice and Aging, is that state and federal lawmakers need to be thinking big.
I don't think it's just one solution. We need many solutions, like improving the availability of at-home care through the Medicare program. And then there's also social insurance type options that go beyond Medicaid and Medicare, like that we see in Washington State.
That example she mentioned out of Washington State is a first of its kind long-term care insurance program that's funded through a new state payroll tax.